Hello, I'm Dr. Smith from Bangor OBGYN. I'd like to speak with you for a few moments in this video about a problem that many women have, and that is leaky bladders. There are some things that can be done that can improve that situation for many women. There have been a lot of discussions in the past about surgery, including mesh. And mesh is becoming a word that many women, many surgeons want to avoid. I've never done mesh. I'm glad I've never done mesh. Let me talk about some of the anatomy and some of the structures that are involved in this situation so you can have some information with which to decide how you want to go forward. So if I take a bandsaw and I cut you in half down the middle with a bandsaw, this is what your pelvic organs look like. Here's the pubic bone, here's the bladder, the vaginal canal and the uterus, and the rectum behind. Now, bladder control is a dynamic relationship between the outside I want to go muscles and the urethra I don't want to go muscles. And that dynamic relationship usually works very well. In this situation, the way the bladder is positioned, this corner right here, this posterior angle, is important for bladder control. Because when a woman laughs or coughs or sneezes, the pressure wave is turned 90 degrees to the urethra, and the pressure actually squeezes the urethra together, and that helps sustain bladder control. Now, after some vaginal deliveries, or sometimes just when, even without deliveries, if a woman's pelvic collagen becomes loose, then that anatomic relationship changes. That posterior angle is blunted. So when a woman laughs or coughs or sneezes, the pressure wave comes around the corner and comes out the urethra, and it creates a control issue. Now, there are several choices for how to try to improve that situation. One easy choice is to give a medicine that relaxes this muscle a little bit. So if the I want to go muscle is less tense, then when it is hit with a stimulus, it won't try to contract. It'll just stay relaxed, and that'll help with bladder control. There are also some medicines that can increase the strength of the sphincter. There are some injections of collagen that go alongside the sphincter that can sometimes lift and boost. I've never done those. I think the medical evidence that those are successful is a little mixed. Sometimes helping a woman with bladder control is as easy as wearing a diaphragm. Now, many of you have heard of diaphragms. It is a structure that is often used for birth control. It's a flexible circle that is worn vaginally that goes behind the cervix and tucks up under the pubic bone. And when that flexible circle is worn, it tucks up that posterior corner and recreates the posterior angle and helps improve bladder control. Now, in this particular situation, when a woman is standing and her pelvis is really more like that, the diaphragm can serve as a floor or a floor support to help prevent sagging and bulging and uncomfortable feelings. So the diaphragm, worn this way, is functioning as a device called a pessary, and some of you may have heard of a pessary. There are many different styles of flexible, silastic medical instruments that can be worn vaginally. When a diaphragm is properly fitted, a woman can't feel it. It's like a contact lens that goes in the eye. I wear contact lenses. When I'm walking around, I'm not walking like this because I can feel it. I can't feel it. It does good things. and the devices worn vaginally function in much the same way. A woman who chooses this to help with her bladder control can place it during a day when she's going to be active. She can decide not to wear it if she's at home and she's just kind of bumming around. If she's going to go exercise, a good time to do that. And so it gives some flexibility to how that bladder support is managed. Some of my patients who are more senior have those of us in the clinic place the pessary, and they wear it for 3 months. And they come in and we remove it, wash it, and put it again. And so they have an every 3-month visit where we manage that device placement and removal for them. So those are the medical and some of the removable choices. There is one more surgical choice that is available, and that's a sling that goes down one side of the pubic bone, around the urethra, and up the other side, that forms kind of a hammock for the urethra and lifts it and helps recreate that posterior angle. That's a surgical procedure that has been around a long time. I haven't done any. I am recruiting physicians to join my practice, and we hope to make that particular procedure available from our clinic team in the relatively near future. In the meantime, there are some choices that can improve your quality of life just in a non-surgical way. So if you have any questions, we are happy to meet with you and to perform an examination and decide how we can best improve your quality of life. So that is my quick discussion about bladder control issues. I appreciate your tuning in. Thank you very much.